My name's Simone Chris. My name's Simone Chris. I use she, her pronouns, and I am the director of the Transgender Rights Initiative at Southern Legal Counsel. For those that aren't familiar, which I think most people on this call are, but just in case, we're a nonprofit public interest organization in Gainesville, Florida, that does statewide impact litigation, policy reform, individual advocacy. But my work really focuses on utilizing federal lawsuits to challenge and overturn discriminatory laws and policies that impede the rights of LGBTQ folks. And if you're paying a lick of attention, you know that there is sort of a never-ending supply of those right now, unfortunately, in our state. I am excited to talk to you all today about access to gender-affirming care for transgender youth in this state. There's a lot of misinformation and confusion and sort of uncertainty around this topic. So I'm hoping that this can help clarify some things and that you all can share this information with everyone you know, because when we spread accurate information and folks are aware of what their rights are, it really undermines the power of this state, because they are passing these laws and policies intending to make it so that we don't know what our rights are, so that providers don't know what they're allowed to do, so that parents don't know if their kids are allowed to get care. So, you know, when we are empowered and educated and know our rights, it's the most powerful thing that we can do as a community. I apologize. I am sick and wildly sleep deprived because my 18-month-old nephew is sick and has not slept all week. So I'm going to try to bring my A game and my best energy here. I'm going to go ahead and share my screen. Sorry, I'm already talking too fast. I knew it. I'm sorry. I'll slow down. Okay. Can everyone see my screen? I can't see any of your faces, so I'm
Yes,
gonna...
we can see the screen.
Awesome. Thank you. Okay. I'm going to try to talk slow. It is not my strong suit, but I'm going to do my very best. So, I introduced myself. You all introduced yourselves. One thing that would be helpful for me is, actually, I guess when we did introductions, folks kind of said this, but just good to know, like, are folks on here from the perspective of like a parent of a trans child seeking care, or an advocate seeking to, you know, make sure the community knows their rights? Are we medical providers, lawyers? But I think I remember the gist of what you all said. If anybody wants to like throw in the chat if they fit into one of these categories, that'd be great. But just good to know like what angle folks are coming at this from. So I'm just gonna kind of give you all an overview of the laws that have passed in the last 2 years. Laws, policies, rules. We know that Florida has not gone about this in a very traditional way, so it's not just legislation that we're talking about here. But we're going to talk about the different measures that have passed that have restricted or banned access to gender-affirming care, particularly those involving minors. I'm going to talk to you about the cases that we filed and won largely, which is exciting, striking down these bans, and the status of access to care right now, because so many people don't know sort of what they're allowed to do and what they aren't allowed to do and where they can get care. So first, I think it's important that folks understand sort of the timeline of how we got here and what happened, because we are not the only state that has banned gender-affirming care. We're not the only state that has banned Medicaid coverage of gender-affirming care. We're not the only state that has done a number of the horrific things that we've seen, unfortunately, being promulgated across the country. However, the way in which Florida has done this is particularly insidious and unique, and I think should be very scary to everyone. And of course, we've struck these things down, and I'm not trying to fearmonger here. I'm saying I think we need to be aware of the ways in which our state and others can use sort of processes that subvert the legislative or democratic process to enact things that they want to see happen. And so, as folks might remember, there were a couple years in a row of legislation bills that were introduced that would ban gender affirming care for minors, ban health insurance coverage of care, things like that. And those did not pass. Our legislature chose not to enact those laws. So what happened was the state, by the state, I mean the governor, put in place political appointees who had particular views on gender affirming care and were known to be opposed to gender affirming care, particularly for minors. And using these political appointees, they used the rulemaking process as opposed to the legislature to enact really harmful rules. And I'm going to walk you through what those were. So none of this was a thing in Florida, right? That none of this was being talked about, or there weren't laws and restrictions in place. It wasn't an issue until April of 2022, when the U.S. Department of Health and Human Services put out a little fact sheet guidance that said gender affirming care is safe and effective and medically necessary, including, hormone block or puberty blockers and hormones. And every major medical organization supports this care for minors. Yep, that's what the science and evidence says. That was just true. And the Florida Department of Health said, nah, not okay with us. We disagree, and put out contrary guidance saying not only is gender affirming care bad, and we recommend against puberty blocking medications, hormones, and surgeries for minors, but they went so far as to recommend against social transition, which is extreme and absurd. If you know what that means, social transition is wearing the clothes that a child wants to wear, having the haircut they want to wear, going by the name they want to use. And we talk about government overreach. I can't think of a more prime example of government overreach than the state reaching into the living rooms of families and telling parents how their children should dress and what haircut they should have and what name they should go by. So what happened was they put out this guidance that said we're directly, strictly opposed to this care, but there weren't actually any laws in place banning it. And in fact, Medicaid, Florida's Medicaid program, had, just flagging the chat for Ming and the other NCLR folks. So Florida Medicaid had actually been covering gender affirming care for adults and minors for a really long time. So that care was covered through Medicaid, and there were no restrictions or bans in place on the provision of care. So the state decided, well, I guess we have to put our money where our mouth is and figure out how to ban this, even though the legislature has said no. So the Department of Health directed the Agency for Healthcare Administration, AHCA, that's who governs or controls Florida Medicaid program, told them to do a investigation, and I need you to see my air quotes, to determine whether gender affirming care is experimental, because if something is experimental or investigational, Medicaid does not have to cover it legally. We know gender affirming care is not experimental. We have decades of evidence, science, studies, and clinical experience demonstrating that it is safe, effective, and medically necessary for the treatment of gender dysphoria. So it was hard for them to come up with this 42-page report to the contrary, but they did. They brought in these, again, doing air quotes, experts from across the country and other countries who are known anti-trans proponents who testify in these cases all around the country, to come to the conclusion that gender affirming care is not safe, effective, and medically necessary, that it is experimental. What I found particularly troubling, and I know some of the folks on this call were in the room with me, when we were going to these hearings and these rulemaking meetings with the state, everybody was wearing these hats and buttons and stickers that said, "Let kids be kids." There was a web page with a slogan on the state of Florida's website that said, "Let kids be kids," because it's under the guise of protecting children, right? In the same way that, people that were opposed to my right to get married said it was about protecting children from being raised by people of the same sex, and whatever. They use that argument for everything, bathrooms, all of it. But when the rule came out, guess what? It banned coverage of care for everyone, adults and minors. So think about a transgender adult that has been on, estrogen for 20 years. All of a sudden, cold turkey, that person no longer has access to their needed medication if they get their healthcare through Medicaid. This is really insidious because people on Medicaid are often those with the least resources to access other healthcare plans or pay out of pocket for care. All that to say, the reason I'm focusing on this is the GAPMS report, which is the generally accepted medical professional standards report that said gender affirming care was experimental, was the foundation, the base upon which all the other things were built. Okay, the Board of Medicine rules, SB 254, all the things that came after were built on that. And that report was held by a federal judge after a 2-week trial where we put all the science and evidence, all the facts, all the experts, we exposed everything that happened, and a federal judge said that this was a political, a sham process that was politically motivated to reach a predetermined conclusion. And that's exactly what it was. So the rule went into effect August 21st of 2022, banning the coverage of gender affirming care for all adults and minors on Medicaid in Florida. Then Surgeon General Ladapo asked the boards of medicine. Again, these are folks that are appointed by the governor. They serve at the will of the governor. We don't get to vote on them and elect them. Just like with ACA, those are political appointees. We don't get to, vote the board of medicine members out of office if they do something we don't like because they're political appointees. So they were instructed to review the GAPMS report and establish a standard of care for the treatment of gender dysphoria. What's interesting is, if you all are familiar at all with this, there already is a standard of care. WPATH, the World Professional Association of Transgender Health, has been putting out the standards of care that govern the treatment of gender dysphoria for decades. They're based on the best science and evidence and studies out there. The Endocrine Society guidelines are another standard they lay out the standard of care for this treatment. So the notion that Florida needs its own separate standard of care, different from the rest of the country and most of the world, is just ridiculous. But nevertheless, so there was a petition to initiate rulemaking where the state asked the boards of medicine to not only categorically ban care for minors, but to also institute a 24-hour waiting period and informed consent forms for adults. The 24-hour waiting period might remind you of the type of restrictions we've seen put in place for access to abortion, or access to reproductive health care. Like the notion that people can't make decisions about their own body. And we're talking, adults as well. The idea that like an adult needs 24 hours to think about it before saying, yes, I'm ready to start hormones, or that they, aren't capable of just making that decision on their own is really unique. And so we're going to get to that in a minute. So in March, the Board of Medicine and Osteopathic Medicine rules went into effect, and that banned care for minors. So what that means is, whereas the process I talked about a moment ago with Medicaid banned coverage of the care, so you could get the treatment, but you have to pay out of pocket for it. This actually made it so that doctors were not allowed to prescribe the care. And if they did, they risked losing their medical licenses, facing discipline and fines and all sorts of stuff. So I mentioned a moment ago, the legislature declined to ban gender affirming care by statute for many, many sessions in a row. Then after the GAPMS report established, air quotes, that this care was experimental and Medicaid banned it, then the boards of medicine banned it. Then they pitched this to the legislature and they're like, look, the agencies that are in charge of protecting the health of the people in Florida have decided that this is bad. So you need to codify these bans by statute. And boy, did they. They didn't just codify these things. They took it further and they made it a crime. They made it a felony for the doctors that I work with. I work in the youth gender clinic on Fridays here at UF, with incredible pediatric endocrinologists and multidisciplinary teams of people who are experts in this. They went to med school and they specialized in this, and they know what they're doing. They've seen the incredible results for their clients. And it overnight became a felony for them to do their job and provide medically necessary, safe, effective, sometimes life-saving care to their patients. I've been litigating this for 2 years and in this fight, and it still blows my mind that this happened. We were the second state to do it. Alabama also made it a felony. Anyway, but not only did they codify the ban on care for minors, they did something that no other state in the country had done, and actually no other country in the world had done, which is putting restrictions in place for adults. We were the first, and Florida, as somebody mentioned earlier, is ground zero. We are battle testing all of these horrible things. And so what they did was they put restrictions in place for adults that included having to see an MD or a DO, so a physician, not an APRN, an NP. Many trans adults in this state get their care from clinics that have nurse practitioners and APRNs. And all of a sudden, those people lost the right to prescribe care, and could be convicted of a misdemeanor for doing so. So adults had to establish with new providers, and there just aren't enough doctors in the state doing this. I have clients that were on waiting lists that were a year long. And so many folks were no longer able to renew their prescriptions or get started on care. They also put in place a requirement that you have to give informed consent in person, so no telehealth, but it included the development of these informed consent forms that the Board of Medicine created, and they were horrible. They were like pages and pages of misinformation that was intended to scare people away from accessing gender affirming care. They required like 40 signatures. They required you bring a witness with you to your doctor's appointment to sign as a witness. And I'm saying also for adults, not just kids. These requirements were ridiculous. So those are sort of the big things that passed, right? So what did we do about it? First, in September of 2022, right after the Medicaid ban went into effect, my organization, Southern Legal Council, alongside Lambda Legal, National Health Law Program, and Florida Health Justice Project, filed a lawsuit in federal court challenging the ban, the Medicaid ban. We challenged it under the Medicaid Act, Section 1557 of the Affordable Care Act, and the Equal Protection Clause of the U.S. Constitution. After a 2-week trial in May, we proved that there was no justification. There was no legitimate basis for banning this coverage of this care for all adults and minors. We were able to show that it was based on politics and animus and bias and a disapproval of transgender people, and not on any genuine concern about health or safety or any science or evidence. I highly recommend everyone read the order in that case. Well, spoiler alert, we won. In June, we got an order striking down the Medicaid ban under each of the claims we challenged it under. This restored access to care for more than 12,000 transgender Florida Medicaid beneficiaries, adults and minors. I'm going to give you guys a little more detail about like the current status and what's going on, but this is just sort of a broad overview timeline. So in March of 2023, we challenged the Board of Medicine rules, right? So SB 254, the statute didn't exist yet. It was just the Board of Medicine rules banning care for minors. And we filed a lawsuit right after those went into effect, challenging those on behalf of parents of transgender minors. And then in June, we got a preliminary injunction that blocked enforcement of those. This very fun thing, and I'm being super sarcastic, happened between March and June right here, where in May of 2023, while we were in trial for Decker, we're in trial on this case, and SB 254 passed. And what that meant was we now had to amend both lawsuits to include a challenge to SB 254, because like I said, the legislature codified, meaning stamped, its approval and put in statute the bans that the two agencies had passed via rule. So in the middle of trial, we had to amend both cases and add a challenge to SB 254. And luckily, we were able to enjoin, meaning block enforcement of the Board of Medicine rules and SB 254. So starting in June of last year, minors in Florida had access to care again. So many people don't know that and didn't know that because the state puts out so much misinformation and people were so confused about their rights. So many providers, even after I would tell them, hey, here's the order, like we won, you can provide care, they were afraid, like when your job becomes something that is like a crime, and you could go to jail, like literally go to jail and lose your license and your livelihood, and over prescribing puberty blockers, that's a pretty good deterrent, right? And so the state effectively used this fear campaign to push so many providers out of providing gender affirming care, and lots of clinics closed. Lots of providers that were doing this before just stopped, and that's devastating because now we just have less providers in the state. Even though it's legal to provide the care again, people are just afraid, and we already had a real shortage of providers doing this work, so it's just been devastating. All that to say, let's go back to the good news. In December of 2023, we had a trial again in federal court where we again proved that all of this was based on animus and bias and a disapproval of transgender people and not any legitimate state interest. And then in June of 2024, just a couple months ago, we got an order that permanently enjoined across the board, blocked forever, all the things we challenged. So the bans on care for minors, the criminal penalties, and the restrictions on care for adults. And I meant to say earlier on, this case, the Doe v. Ladapo case, was filed with our partners at NCLR and GLAAD and the Human Rights Campaign, HRC. Okay, so this is good news, right? Really quick, just going to run you through the status of the other laws. If you're interested in education issues and in LGBTQ rights in school, I urge you to watch the recording from the presentation I did on Tuesday, which was called Access to Safe School Environments for LGBTQ Youth. I'm not going to go into all that. This one is focused on healthcare, but just a quick rundown. Medicaid ban was struck down by a federal court. The minor bans were permanently blocked by a federal court. The adult restrictions were permanently blocked by a federal court. The Don't Say LGBTQ law was significantly narrowed by a settlement agreement with the state. It's still in effect, but it was narrowed. The pronoun ban, which is like part of the Don't Say LGBTQ law expansion, we have a federal lawsuit challenging that, and we were able to temporarily block it, and we're about to defend that at the 11th Circuit Court of Appeals. And that's about teachers being able to use their affirmed pronouns. And then the drag ban was also blocked by a federal court. So even though I'm throwing like so much bad news at you, and this is all like soul crushing that the state is doing this, I hope it gives folks hope that like when we put all the facts in front of a judge, when we put the law and the facts, apply the law to the facts, these things crumble. They crumble because there's no justification. They're just cruel and intended to hurt trans people. And so the good news is like we are winning in court, even though I think as somebody that lives in Florida and as an LGBTQ person, like it feels often like we're losing across the board. We're really not. And so I hope that folks can feel a little bit hopeful about that. Okay. So I went through this. I'm not going to belabor the point, but I just wanted to note that like let you guys see which rules and which laws we actually challenged and struck down. Some of the requirements in the emergency rules that the boards of medicine implemented included like really burdensome, unnecessary things, like every 3 months having a suicide risk assessment done by a board certified psychologist or psychiatrist, which I don't know if you guys have tried getting mental health care in Florida recently, but it's not like it's easy. So finding a board certified psychologist or psychiatrist that has expertise in the treatment of gender dysphoria and who is willing to see you every 3 months is insane. Required DEXA scans and bone scans, and blood work and all these things at intervals that are not recommended by the WPATH standards of care. It was way too much. It was just to make it harder to access care. They required, that mental health for all minors be only from psychologists or psychiatrists and not, licensed clinical social workers and licensed mental health providers, who we know are oftentimes even more experienced in this and have like the one-on-one relationship with the patient. Anyway, all that to say, the Doe v. Latipo case that I just mentioned is the case that struck down the Board of Medicine rules and SB 254. And I'm not going to go through all of this, but if you guys want the PowerPoint, please feel free to ask. It just lays out sort of the timeline of how we did this. And I will note that we did win a motion for class certification, which means it became a class action. So they can't say, oh, only the people that were involved in the lawsuit are allowed to get care. It was made clear because it was a class action that all minors that need gender affirming care and all adults that need gender affirming care are able to access it. Because in other cases, you guys might remember, including in the preliminary injunction we got in June of last year for minors, the state was like, oh, no, this doesn't apply to everybody. It only applies to the 3 named plaintiffs. Those 3 people can get care, but no one else. And we did not want them to be able to sow confusion and doubt among the community by saying things like that. So, okay. We had a trial again, like I said, and then we got the order striking it all down. Like I said, this was the first state in the country to ban or to restrict care for adults. So our lawsuit was the first lawsuit setting precedent, addressing that putting restrictions in place for transgender adults is not okay. Both cases I mentioned, Decker and Doe, the Medicaid case and the SB 254 Board of Medicine case, are on appeal at the 11th Circuit. The state has tried to stay the order, meaning basically go back to care being banned for everyone and restrictions being in place, pretending like the order never happened. We successfully defended against that at the district court level, and now we're defending against that at the appellate level. I'll keep you posted. But as of now, I cannot stress enough, if you only take one thing away from this, tell 10 people and ask each of those 10 people to tell 10 more people that no bans on gender affirming care exist in the state of Florida right now, that no restrictions on care for adults exist, that doctors can prescribe care to minors, full stop, because so many people still don't know. So I think it's really like sometimes like my job is really boring a lot, right? Like as lawyers, we read a whole lot of boring case law and people's eyes glaze over when I ask them to read things. But these orders we got in these 2 cases are so good, you guys, like so good. So Judge Hinkle makes clear that this was based on animus and bias, which is what we need to survive at the 11th Circuit Court of Appeals. And the language he uses is so beautiful. He compares, transphobia basically to racism and misogyny, and says, trans folks or trans opponents are free to hold their beliefs, but they can't discriminate against trans people, and they can't deny them care that is available to anyone else for any reason other than supporting their transgender identity. So anyway, I highly recommend reading the order. It's really good. So just so folks know, if you're a parent of a minor, if you're a medical provider, if you are an advocate that's going to share this information with people, here are the things that are actually in place right now. Puberty blockers and hormones for minors have to be prescribed by a physician, an MD or a DO. That was how it was before these laws anyway. And but for adults, they can get care from APRNs, NPs, any other qualified provider. The first time, only the first time that a medication is prescribed, that's never been prescribed before, in-person consent, informed consent is required, but not on those ridiculous forms that the Board of Medicine created, not on any specific form. It can be verbal, it can be using whatever document. The people were always getting informed consent is the point. Doctors were always going through an informed consent process before prescribing any medication or any surgery, not just for transgender kids. So it just takes us back to the status quo where we were before these laws went into effect. Minors have to have annual mental health assessments, but instead of by a psychiatrist or psychologist, it's any licensed mental health care professional. And then they're supposed to get mental health care at the frequency that the mental health professional recommends. So not dictated by the state as a one size fits all. Everyone has to conform to the same, requirement. It's whatever is right for that person. And that's how healthcare should be provided, right? It is individualized. It is based on the needs of that individual patient. And it should be a decision that is between the patient, their parent, and their doctor, not by the state. Okay. And then obviously the regular criteria that is in the WPATH standards of care. So if it's not on this list and someone tells you it's required, put them in touch with me. Okay, so the bans on coverage. We just talked about the bans on provision of care. We already talked about this, but what I'll say is, in addition to that process I talked about in the beginning, where AHCA, the Agency for Healthcare Administration, passed a rule that banned coverage of gender-affirming care for all adults and minors under Medicaid. When SB 254 was passed, the law that most people know as the gender-affirming care ban law, right? It also codified this provision that said no state money can be spent on gender-affirming care, and that included Medicaid, but that was another piece of SB 254. And then it also codified an exclusion that I actually challenged back in 2020 before this whole slew of anti-trans laws happened. But there's an exclusion in state health insurance plans. So anybody that works for the state of Florida who is transgender or who is cisgender and has a transgender child or spouse or any other dependent, it excludes coverage of gender-affirming care for all state health employees or state employees who get their health care through the state. So we challenged that back in 2020, and I'm going to give you an update in a moment. But these are the things that impact coverage. There is no ban on any other private insurance or marketplace insurance or any other insurance plan covering gender-affirming care. Uh-oh. Okay. So a little bit more in the weeds on Decker, just a few quick things. We already talked about this stuff. We got an order striking it down, right? And saying that it was unconstitutional, violated 1557 of the Affordable Care Act and violated the Medicaid Act. I can't see the chat and I'm worried that I'm being told to slow down and I just can't see it. I don't know where it went though. Ming, if I'm being told to slow down, let me know. Thumbs up, slow down, or thumbs up, don't slow down.
Oh, you're fine. I haven't seen anything.
Perfect. I think me being sick probably has helped me be slower than I was on Tuesday. Okay, so we won, right? And I cannot tell you how frustrating it is to have litigated this case and put countless, I mean, I can't begin to tell you the number of hours of my life I spent and others spent on this case. It was time consuming. It was expensive. It was grueling. We basically missed Christmas because we were in trial in December. Oh no, that was Doe. Anyway, point is it was a really hard case. And to get to the end and to win, and then to have the state pretend like we didn't. So what's happening right now is the state of Florida is continuing to deny people coverage under Medicaid for their gender affirming care. And what's very frustrating is this case is on appeal at the 11th Circuit, and we have oral argument in Atlanta in November. And the district court's hands are tied. The trial court said, I can't really do anything until the 11th Circuit rules on your case. And in the meantime, people are still being denied care. And I'm having to individually, for each person, appeal the denials and go through this whole ridiculous administrative process and jump through hoops because the state is horrible. I mean, I don't know what else to say. They're just like refusing to comply with a court order. And we did a motion to enforce the judgment. But again, because it's in this state of it's on appeal, the trial court can't change the factual record right now. So it's the state is not making anything easy. But the point is we won and it was deemed unconstitutional and they need to stop enforcing it. And that will be made clear once the 11th Circuit rules, and then the trial court can enforce it. Okay. Also some great lines from this order, including an entire subheading called Gender Identity is Real. And it's so sad that in the year 2024, we need a judge to say that gender identity is real. But Judge Hinkle was clearly of the mind that the state disagrees, right? The state had made it so clear that they don't think gender identity is real, that there was a whole heading under that. And I just thought it was beautiful. He says the statute and rule were an exercise in politics, not good medicine. And he references, I'm sure all of you remember when Representative Barnaby called transgender individuals who came to speak to the legislature mutants and demons. And through these two cases, Decker and Doe, we really were able to paint a picture for the rest of the country about just how hateful a lot of our lawmakers are. And I think it was really exposing. Folks were saying things so freely on the public record and tweeting them that I think having them blown up big during trial as a closing argument, demonstrative, hopefully will deter them from continuing to use that kind of language and rhetoric that we know has real life mental health implications for transgender youth that are hearing the adults that are supposed to be protecting them and making decisions about their rights, saying these horrible things about them. And so I think really putting a spotlight on that was, I hope, helpful and will deter future really ugly behavior. Okay, so then the last thing I'm going to mention in terms of the status of these laws is in Clare. This is a case I filed in 2020 before, this wave of anti-trans DeSantis laws. But this was challenging the state employee healthcare plan. And the complaint was filed in January of 2020. And we had finished briefing summary judgment motions, which means we tell the court we don't need a trial. The facts and law mean we win. And the state says, nope, the facts and law mean we win. And you can just rule on it. We have been waiting for 3 years. And finally, in May of this year, the judge in that case said, oh, this has been sitting here for a while. Do you guys want to do some supplemental briefing? And we're like, yeah, a few things have happened in the last 3 years. So we finished supplemental briefing in June. And then on August 1st, so earlier this month, we got an order saying that the exclusion for state health or state employees, the exclusion in their healthcare plans, violates Title VII. And Title VII is the employment statute that says you can't federal employment law that says you can't discriminate on the basis of sex. And we know that discrimination against transgender people is inherently sex discrimination. We are now briefing the relief that we want him to order, and we're likely going to go to a trial on damages because these people for the past 4 years have had to pay out of pocket for care that they needed that should have been covered, but wasn't because of this exclusion. Okay. So strategizing, I'm almost done, and then we're going to open this up for discussion. So strategizing about all of this, right? Actually, I just want to say one other thing really quick. No, I'll say it in a minute. Okay, so the state of Florida's playbook, right? This is just my personal opinion, having been litigating against them for the last 3 years. They are they cannot succeed unless their misinformation campaigns succeed. They have to be able to convince people that this is protecting children, that this is harmful, that, you know, that we are groomers and pedophiles, and like all the rhetoric. That's a huge part of them being able to actually affect laws and changes and policies. And so obviously, you know where I'm going to go with this. Like, how do you dispel misinformation? You have accurate information and you spread it far and wide. We know that, you know, a lot of the basis for the bans was you know, this is going to hurt kids, and their evidence of that was these people coming in from other states who are self-identified detransitioners who, you know, express regret about the care they received. And we were able to demonstrate that none of these people were from Florida. None of these people received care in Florida. And none of them authentically just came here to share their story. Rather, it was a coordinated strategy between the state and these far right groups that bring these folks in to testify in like every state. And so it was not authentic. It was very much manufactured. The state relies on sowing confusion. They enact these laws with vague and undefined terms. So a perfect example of this is the Don't Say LGBTQ law, where they literally didn't define any of the things that were now prohibited. So banning classroom instruction on sexual orientation and gender identity. What does that mean? People weren't sure, right? What did age appropriate or developmentally appropriate mean? People weren't sure. So what do we do when we aren't sure what we're allowed to do? We err on the side of caution. So we saw teachers purging LGBTQ related books from their classroom libraries. We saw gay teachers, you know, and trans teachers going back in the closet, not mentioning their partners. We saw people taking safe space stickers down off their walls. All of these things together cumulatively make schools a less safe place for LGBTQ youth. But it's in response to this scary law that I don't want to lose my teaching license. I don't want to get fired. I don't want to get sued. So people err on the side of caution. And that is the goal. That is by design. They want us to be confused. They want doctors to not know if they're going to go to jail for prescribing gender affirming care. They want clinics to stop seeing trans patients altogether. And they've been super effective and successful in that because honestly, they're very organized, right? And we need to get more organized, and we need to, and this is not political. I'm not saying them versus us. I'm not talking political parties. I'm not talking any of that. I'm saying people who believe that transgender people deserve equal rights and access to medically necessary healthcare, and people who don't. So we need to be, you know, empowering one another, knowing our rights, and knowing exactly what we are and aren't allowed to do, because then they lose. It just takes the wind right out of their sails. And the last thing, like I said, is intimidating providers into no longer providing this care. Not only, you know, does the law itself create a lot of fear for providers, but also the members of the House of Representatives subpoenaed Florida medical organizations, accusing them of, you know, mutilating children, and you know, just they use all these fear tactics that are intended to like push people out of this space and make them feel like, okay, it's not worth it to keep providing this care. And many providers did leave the state and did close their practices and did stop providing gender affirming care. So what's the advocates playbook on our side, right? Dispel misinformation. I'm gonna ask you to hold on to this one really important fact. I talked a lot about what is and isn't allowed in the state of Florida when it comes to healthcare, right? It's not illegal, it's not banned anymore, you know, blah, blah, blah. I'm going to mention one thing that's not healthcare related that I think is so important that folks know. When SB 254 first came out, there was a lot of confusion and a lot of fear that the custody provision was like what we saw in Texas, and that children could be removed from their families, from their parents, if they received gender affirming care. And it's crazy that that's still something that's going around. but it is. And I need folks to know that is absolutely not true. It never was. And there's nothing in place that is like what happened in Texas. The SB 254 custody provision says that for out-of-state families, that a Florida court could take temporary emergency jurisdiction over a case from another state, a custody case from another state, if the child is being subjected to gender affirming care, basically. So one parent could, bring their kid here, say we're going to Disney, and then pop over to the Orange County courthouse and ask that judge to take jurisdiction over their, California custody case, to favor the non-affirming parent. I'm not saying that's not bad. What I'm saying is that is very different than people who live in the state of Florida, residents of the state of Florida, being at risk of having their children removed. It does not implicate, the law here does not implicate DCF, the Department of Children and Families, the child protective agencies, the child welfare system or dependency system at all. There is no mechanism by which you can have your children removed from you because you're letting them access care that has been deemed medically necessary by their medical provider. So I just want to dispel that myth because it is very harmful, and I would hate for any parent to not be getting their kid the healthcare they need because they're afraid they could lose custody. That's a really scary idea. Okay, raise awareness and educate others. Not only am I asking you to, tell 10 people some of the things I've mentioned here today, but don't assume that your medical provider or your child's medical provider knows the status of all this. I talk to doctors, nurses, psychologists, social workers all the time that had no idea that we'd won this case and the bans were struck down. So don't be afraid to, educate even your providers or people around you that are involved in the provision of healthcare. Print out the order, give it to them, or at least the relief section that says it's permanently enjoined. It's so important that we're educating each other and those around us on these issues. Get involved, show up at so for the two processes I mentioned earlier, where AHCA banned Medicaid coverage and the boards of medicine banned coverage or the provision of care to minors. Both of those rulemaking processes included a bunch of public hearings, and the other side was coordinated, and they had these detransitioners come give their sob stories, to build a record of this is bad care. They had known anti-trans doctors fly in and give testimony about how this is bad and it's not supported by science and evidence. We have to be showing up and coordinating and getting real Floridians, people who are actually impacted by the laws being enacted, taking our rights away. We need to get folks to show up and share their stories and have their voices heard. What I'll tell you is, if you are somebody that submitted a public comment, a written comment, and you think that didn't do any good, let me tell you, as part of the discovery in both of these cases, I read every single comment submitted to both agencies. We were able to use the statistics of, 70% of the people that weighed in opposed these horrible bans, opposed taking healthcare away from kids, taking the rights of parents away to make decisions for their children. And it really does matter. And we were able to use that as evidence, and it was part of what helped us prove our case. So trust me, it is not a waste of time. And even if it seems like your voice might not be being heard, it is. And this applies to, when we're talking about access to reproductive health care, when we're talking about racial equality, when we're talking about, laws being passed that impact kids' ability to access a safe school environment, across the board. Just get involved, show up, make your voice heard, because it does become a part of the record. And I promise you, we're going to be litigating all of these things, and those records matter. And then obviously challenging discriminatory laws and policies. We couldn't It's not easy being a plaintiff in a federal civil rights lawsuit, but without people willing to be represented and challenging to challenge these laws, we wouldn't be able to do anything about them, and we wouldn't be able to get these victories. And then create safe spaces for others. I wear this little Protect Trans Kids pin all day, every day, all the time. And it creates an immediate safe space for kids that might otherwise be afraid. Is this going to be another adult that's I'm gonna have to explain my gender identity to them? They're not going to understand what they them pronouns, how to use them or why. And it sort of just creates an environment where the person can be at ease and know that you're going to be a safe space. And it also is great for opening up dialogue with people who might have questions and might not understand. And that's part of, all the other things on this list: dispelling misinformation, educating others. We have to be having conversations. And I think, explaining the problems inherent in the gender affirming care bans is so relevant to and kind of intertwined with the justifications for and the things supporting taking away reproductive healthcare rights and taking away access to abortion, taking away access to birth control, removing from our schools the ability to educate youth on sexual health and safe, how to be safe and HIV transmission and all these things. And the some of the very same arguments, like they're not old enough to understand who they are or to learn, about these other things that some parents don't want their children to know about. The idea of, informed consent in the gender affirming care context and, needing parental consent in the reproductive healthcare context. These things are very much intertwined. And so I think understanding one really helps us to understand and dispel misinformation around the other. Also the chilling effect is not just on providers of gender affirming care. The chilling effect of these laws where doctors and providers are being criminalized leads to hesitancy to treat transgender patients at all. And guess what? Transgender people, non-binary people, gender non-conforming people need primary health care. They need to go to the emergency room. They need the same healthcare everyone else does in addition to gender affirming care. And so when providers are worried about treating transgender patients at all because of these laws, these folks might be missing out on and losing access to just everyday healthcare that they need that is completely unrelated to their gender dysphoria. I know there are providers that have shared with me hesitancy around even just having conversations about things like, sexual health and HIV transmission and fertility and pregnancy and things of this nature because of fear, like when it comes to having transgender patients, because of a fear of violating any of these just numerous laws that are basically making it seem like being transgender is bad, teaching children that LGBTQ people exist is bad, teaching any sort of accurate information about any of this is illegal. And so it leads to providers not being able to engage in the robust, important, accurate conversations with their patients that they need to be having in order to make sure that their patients know how to be safe. Okay. I'm going to show you guys a couple resources that I want to make sure you know how to find, and then we're going to open this up for discussion and questions. So the Campaign for Southern Equality has an emergency grant for anybody in Florida who either their child is unable to access care or they aren't able to pay for it. So like if your insurance denies it or your Medicaid, you receive Medicaid and it won't cover it, they give out micro grants that help cover even going out of state to get care elsewhere if needed. And so that's on their website. You go to emergency grants for impacted families and you can put my name where it says, where did you hear about us? And they were one of the partners on this with them. So they know, that we refer people there. On our website, southernlegal.org, there's a section on transgender healthcare that has resources and information about the lawsuits that I talked about today and all that good stuff. There's also a section on LGBTQ school advocacy, the rights of LGBTQ students in schools. And again, feel free to watch the presentation from Tuesday that I did on this topic, but just want you to know where to find these things. On our website, there's a bunch of handouts that I talk about in that presentation that are helpful for knowing your rights and fighting back against districts that are not affirming your child. This is a Know Your Rights Back to School handout that I created that walks you through all your rights and your child's rights at school. And then Florida Name Change is a website I created to help people with name and gender marker changes. It's free, safe, user-friendly. It's like TurboTax for name change. You can go to www.floridanamechange.org, or on our website, there's a section about it. And it allows you to walk through the whole process of the name change petition and filing that in the court and getting a name change court order. But then it also walks you through how to change your name and gender marker on your social security record, driver's license, passport, birth certificate. And this presentation is not about identification documents, but because so many people have questions, I'm going to just say one thing. Right now, the state of Florida is refusing to amend gender markers on driver's licenses and IDs, and also birth certificates. We're working on 2 lawsuits that we're going to be filing soon to challenge those. I cannot say this enough. I implore you, tell every trans person you know, get a passport. Who knows what's going to happen with the next election, and we do not want to end up in a place where we no longer have the right to change our gender markers on our passports, and we haven't yet done so. So I recommend that everyone get a passport that says the correct gender marker and the correct name. Update your social security record, and you can update the name on your license and birth certificate. They're just not amending gender markers right now. If you have more questions about that, let me know. All of this is also going to be on a website that I'm launching very soon for another nonprofit I created called Stopgap Florida. It'll walk through everything I talked about today and much more, and keep you updated on all the lawsuits, the status of the laws, etc., so that folks know their rights. Okay, so now that we are to the end, I want to open it up for questions about the material that I just presented, anything that I said, other ideas that folks might have to add to my list of, how we get involved, what is our strategy, what does our playbook look like for opposing these anti-trans laws, how do we prevent further attacks on healthcare rights for trans folks, and ideas for how we can advance health equity for trans and non-binary youth in Florida, including accessing gender affirming care and other essential health care. So I welcome questions, comments, feedback.